As of noon today, Pennsylvania had 10,049 new positives, 278 deaths. Local counties, Cameron County went up by 28, Center by 105, Clearfield by 86, Clinton by 38. Clinton is now at 1,403. Elk went up 40, Lycoming 165, Northumberland 95, Potter 12, Tioga 33, Union 44. Local zip codes. Cross Fork has the first COVID positive. Renovo went up 1 to 53. Carthus went down by 7. Snowshoe went up by 1. Middle Hall went up by 9. Beach Creek 1. Blockhaven 13. Jersey Shore 13. Bellefonte 31. State College 30. Loganton 2. Williamsport 59. Colleges remained on the same, unchanged. It looks like between confirmed and suspected positive, Keystone Central is showing 41. Local hospitals. Clinton County has 9 hospitalized, 0 on ICU and 0 on event. Lycoming has 94 in the hospital, 14 in ICU, 7 on event. Center has 50, 4 in ICU, 4 in event. Montour has 135, 36 in ICU, and 24 on event. We had our Clinton County Emergency Coalition meeting today, and we reviewed some interesting information. If I can get my fingers to work. With the community testing that was done down at the Castanea Fire Hall grounds, they did 1,150 tests. That was a little bit over the 2,250 that were allocated. Of those, some have already received results, and a surprising number of those results appear to be non-symptomatic positives, which really isn't surprising.
No, that's why it's spreading so fast.
We also talked about the snowstorm that's coming now. And one of the challenges is, not so much for us right here, but larger metropolitan areas oftentimes engage the National Guard to assist with snow removal. That's more difficult this year, right now, because they've got National Guard out at facilities dealing with COVID. So they don't have the same manpower that they typically have. So it may take some of the more urban areas a little more time to get this storm under control, so keep that in mind. UPMC currently has 28 ICU beds. They have another 12 that they can bring online, and they've got other spaces where they can perform ICU level services if it needs to get, if it gets to that point. Department of Health continues visits. We've had our infection control visit. We've had both of our visits, and both times they found no infection control deficiencies as a result of those investigations. As we talked about a couple times before, they've actually taken a couple of best practices from what we do here with them to share with other facilities. One of those best practices is actually this meeting, giving us an opportunity just to share accurate, up-to-date information and to give everybody here the opportunity to ask questions. Over the last couple days, there were 2 home deaths in Clinton County. There were people that were at home, never went to the hospital. They were COVID deaths. They were COVID positive. We have a little, some other information to share, COVID specific. On December 30th, emergency educators will be here in the facility. They will be training a couple of us to do N95 mask fit testing, and they will also help us fit test the entire building. So they will be here from 7 o'clock to 4:30ish. They will train a couple of us first, and then everybody that's trained plus them will work through the building to fit test as many people as we can. The benefit to that is, once we're trained, we can continue to do that here without anybody else coming in to assist with that. So they're supposed to be providing the equipment that we need to do that. Again, this is being done at no charge to the facility, but it is an important step in keeping us all safe. We also got word yesterday that we have the dates for our vaccines.
Yes, we have tentative dates set by the CVS level of the pharmacy. We have these dates, which are the first week of January and the last week of January, will then be verified by the local Omnicare in Williamsport. We do have sign-up sheets at the time clock, the ER, the front desk, and the clean utility. If you are interested in receiving the vaccine, you need to sign up so that I can give a number to them of how many consent forms they will send me. And they will send me forms that are in triplicate. You must fill it out
I
in its
copied some
entirety.
today, and we're gonna have to pass them out ahead of time, because
Oh yeah, they have to go out ahead of time.
extremely detailed.
Yeah, they're very detailed.
Yeah.
You will have to sit down and fill these out. You also will need a copy of your insurance card front and back. And as we stated before, this is for purposes of their billing for administration and supplies, no out-of-pocket expense. They will come on these dates, they will set up, they will pick a room, they will take care of everything. What you have to remember is it's 2 shots. You'll be assigned, you can come the first date, the second date you come back and get your second shot. Now they had said there was a third date, but they didn't send it to me yet. That would be for anybody who didn't get it the first time, gets it the second date, and then needs the second shot on the third date. But at this point, I only have 2 dates, so I have to check on that. Anybody who is an employee, volunteer, maintenance, auxiliary services of any kind that are in our building can get this. Any contract employee, anybody like that. It is not extended to family and friends though. We'll have to wait for theirs. A lot of information on the CD website regarding the vaccine. I have some handouts that I took off the CD website that Omnicare sent me. I can put some of those out in case you want to read that information. If you have any other questions, just let me know. And if you have any questions now that I can field on back into the vaccine process.
The first 2 dates that we have tentatively are January 6th and January 27th. 21 days apart, which is what the recommendation is for getting your second shot, is 21 days. So we would anticipate our third date to be 21 days from January 27th, which is like February 17th, I think. Question. Looking at the traffic on our website, it seems that we do have some people that are watching these, or at least going to the website for some COVID-specific information. So I'd like to try something a little bit different, and I'd like to offer anybody that's watching this at home, if you have questions that you would like us to address, please call the main number, leave your question, and then we will answer it the next day we have a meeting. So any specific questions that you have related to COVID, what our response looks like, what we're seeing in the community, any concern that you have, we will try and find you an answer for. Any other questions? That's all I have, thank you.